So now we're making our way down to the legs, right, to the lower appendages on the appendicular skeleton. This particular bone that we're going to focus on first is the femur, which is found in the femoral region. As far as the structures that, or the features that we need to be concerned with, obviously you see the head here, just lateral to that, the neck, and as you make your way lateral to that, again, not very visible on this particular plastic model, but between these two bony structures here, known as the trochanters, you would have the intertrochanteric line. So this is the anterior aspect that we're seeing. If we look at the posterior aspect, you get a better view of those trochanters, this being the greater and this being the lesser trochanter. So greater trochanter, lesser trochanter. Between both of those, you also see the intertrochanteric crest. And again, in life, all of these structures would function as sites for muscle attachment. And if we stay on the posterior aspect, making our way down the diaphysis towards the distal end, you see the linea aspera here. And as that linea aspera goes kind of beyond the midpoint of the diaphysis, it splits into supracondylar ridges. And again, those ridges are kind of tough to see on this model, but they're there, and just like the line, they're going to function as sites for muscle attachment. Now those supracondylar ridges will end at the distal end, just superior to the condyles of the femur. And now the condyles are going to be named based on their position. So this would be the medial condyle, and this would be your lateral condyle. In between, you have the intercondylar fossa. Right? Intercondylar fossa. Now you can use that intercondylar fossa to help you determine left versus right. Right? So in standard anatomical position, the intercondylar fossa should be pointing posterior. Right? Once that's posterior, you notice where the head is. You know the head should be pointing medial. So in this case, this is going to be a left femur. Right? If we look at the anterior aspect again at the distal end, here you see the patellar surface, where the patella, right, would kind of sit in place as it rests within the patellar ligament. Right? Now as far as the patella, you just need to be able to identify it. Now it's a sesamoid bone, and you should be able to determine left versus right by looking at the articulating facets that are on the posterior aspect. So the lateral articulating facet is the larger of the two. Right? So you can see that there, while the medial is slightly smaller. Right? So once you recognize that this is the larger facet, that's lateral. Again, point that posterior, and you